Hi, good afternoon. My name is Terika Thomas Mills, and today I'm going to be performing my hand washing and sterile gloving video. For this video, I have my gloves, and when choosing your glove, you have to make sure that it's the right fit. But for the purpose of this video, this says one size fit all, so that's what I'm going to be wearing. So I'm going to proceed by doing my hand washing. So in order to do my hand washing, I'm going to turn the faucet on. I'm gonna make sure the water is not too heavy, it's not flowing too heavily, and the temperature of the water is warm. So I'm gonna wet my hands from my wrist down, make sure that my fingers are pointing downward, and then I'm gonna use 3 to 5 milliliters of soap. I'm gonna lather that in. I'm gonna scrub in between, scrubbing from my wrist down, making sure my nails are clean. I'm gonna interlock, go in between my fingers, and then I'm gonna scrub for at least 15 seconds. Make sure under the nails are done and in between the fingers are scrubbed. Alright, so now that I'm finished scrubbing, I'm going to rinse, ensuring that my fingers are pointing down at all times. And I'm going to rinse. Okay, now that I have rinsed my fingers, I'm just going to allow them to drip a bit. I'm not going to shake them or splash them. I'm going to let it drip a little, and then I'm going to dry using a clean paper towel, and then I'm going to dry from my wrist down, dry between my fingers, ensure my hands are properly dried. Now that it's dry, I'm going to discard this paper towel in the trash, and then I'm going to take a second piece of clean paper towel to turn the faucet off, ensuring that my fingers or anything doesn't touch the faucet, because then my hand would become contaminated all over again. So I'm going to turn it off, ensuring I'm not touching the faucet. Okay, so now I'm gonna have to touch my device so I could record the second part of the skill. So I'm gonna move this over a little bit. Okay, so here I have my glove, and I'm gonna lay it on a surface. I have to make sure the surface is flat and it's clean. So I'm gonna use these fingers, and I'm gonna open it. I'm gonna open it. I'm sorry, I'm trying to get the camera in the right position so it could adequately capture what I'm doing. Okay, I think that's better. So I have opened my packaging for my gloves. I'm gonna discard the outer wrapper. Okay, so I am gonna carefully open the package. Ensuring I'm not. Okay. So the package is there. I'm gonna open it so that the gloves are exposed, but in order to open it, I have to ensure that I'm not touching the gloves itself. Instead, I have like a 1-inch margin on the outside. So that's where I'm going to be holding. And I'm going to be holding the 1-inch margin on the outside. And then I have opened it, not touching the inside. And if I have to touch anything, it's only on the outer 1-inch margin of the sterile field, just to ensure that I'm not contaminating the gloves or the inner region, which would be considered the sterile region. So if you look at the way these gloves are, one for the right, one for the left, and you can identify which is which by how the thumb is pointed on the glove. So first I am gonna glove my right hand, because since that's my dominant hand, so I'm gonna use the left hand. I'm gonna take the right glove, since the right hand is the dominant hand. I'm gonna glove my right hand first, and then I'm gonna use these 3 fingers, and then I'm gonna pick up the right glove, holding on to the cuff, the inner area of the cuff, because I don't want to touch anything on the outside, because then the glove becomes non-sterile. So I'm holding on with my 3 fingers. I'm gonna try to work my fingers in. I'm gonna try to put my thumb in first. While ensuring I'm not touching the outer part of the gloves. I'm still holding on to the folded region, working my fingers in. And see, my glove is on. I haven't touched the outer region, so it's still sterile. So now I'm gonna put the other one on, and in order to put the other glove on, I'm gonna take these 4 fingers and I'm gonna tuck it on the under the cuff, while my finger, this thumb, is pointing outward, and then I'm gonna try to put my fingers in, still not touching. Well, it's okay for this hand, my dominant hand. It's okay for my dominant hand to touch the outer part of this glove, since the glove is sterile. All right, now that both gloves are on, I could pull it back a little without touching, trying not to touch my bare skin. Okay, so my gloves are on, right fit. Okay, so after I have performed my procedure, I am gonna remove my gloves. And in order to remove the gloves, I could pinch. I'm gonna pinch, and then I'm gonna pull it back, turning it inside out, making sure I'm not touching the outside of the glove, because this time you're not protecting the gloves anymore, you're protecting your hand from the glove that's now contaminated. So this one is off. I'm gonna put it in a bowl, and then now I'm gonna use my finger and I'm gonna tuck it on the inside of the glove, ensuring I'm not touching the outside, and then I'm gonna take this off, inside out. See, now the gloves is off. I haven't touched the outside of the glove, which more than likely has been contaminated. So now I'm gonna discard the gloves in the appropriate trash container. And now that I'm finished, I'm gonna exit, but before I go, I'm gonna perform hand hygiene. Okay, now that my hands are clean, I'm gonna I'm sorry, I should have discarded this also. So since I haven't left yet, I'm gonna discard. Again, I'm gonna have to perform hand hygiene. All right, my hands are clean. I'm gonna leave the room and close the curtain for privacy, and I'm gonna go document.